You all know who Mark Cuban is. He's the Shark Tank superstar, billionaire, owner of the Dallas Mavericks. The sharp business tycoon is making headlines again for disrupting the healthcare industry. This should not be surprising because Mark Cuban is always preoccupied with his money, making shenanigans. This time, the billionaire has created an online pharmacy along all things. The business, called Mark Cuban Cost Plus Drug Company, or mccpdc, has been running for some time now and aims to provide prescription drugs at a lower price than other brick-and-mortar retailers. Currently, the three largest pharmacy benefit managers, CVS Caremakr, Express Scripts, and Optum RX, have a stranglehold on more than 80% of the American prescription drug market. There has been a large problem holding back America's healthcare system for decades. This is the pharmacy benefit manager, a symbol of everything wrong with American healthcare today. Initially, pharmacy benefit management companies, or PBM for short, was created to lower drug prices. PBMs are supposed to work with governments, employees, and labor unions to decide the availability of drugs, determine drug prices, process payments to pharmacies, and negotiate price rebates to lower health insurance premiums. The PBM system's goal was to pass along price savings to its patients. However, this has not happened. PBM's lack of transparency has allowed the convoluted mix of players who take cuts as the money is passed along. These players keep too much of the money for themselves. They also jack up the prices for certain cheap generic drugs, so they are sold with a markup of up to 1000%, which ultimately raises drug prices overall. The entire system is the problem. There's a law in America which says that hospitals have to show their pricing for their top procedures, but some hospitals have refused to do so and are willing to risk the $100 a day fine just to keep their prices hidden away from the public eye. According to a Gallup poll, 18 million Americans were unable to afford at least one prescription drug in the last 3 months. Even President Biden has said that he wants to do something about the outrageously expensive US drug market. Currently, people try to navigate through the expensive US drug market by using insurance plans, coupons they find through GoodRx, and traveling to other countries to get their stock of medicines. The value proposition of Mark Cuban's pharmacy company is that patients would pay less money for generic drugs by cutting out the pharmacy middlemen, like pharmacy benefit managers who charge hidden fees. Mark Cuban wasn't the one who came up with the idea. For a long time now, hedge funds have a habit of buying up drug companies and jacking up drug prices to raise profits. One such case happened a few years ago and involved a hedge fund manager called Martin Shkreli. Martin Shkreli had founded a company called Turing Pharmaceuticals and bought the rights to the drug Daraprim. He raised the price of Daraprim by 56 times, so Daraprim went from a $14 drug to $750 a pill overnight. People were outraged, and Shkreli would promise to lower prices before backtracking and choosing not to lower prices. The controversy got so heated that Shkreli was forced to testify before Congress, where he invoked his right to the Fifth Amendment to avoid self-incrimination, refusing to answer all questions except two. People were unhappy with Martin Shkreli, and one of them happened to be a doctor called Alexander Oshmiansky. The emergency radiologist emailed Mark Cuban to pitch his idea of starting a specialty pharmacy selling drugs that were in high demand but were in short supply and selling those drugs at reduced prices. Basically, he wanted to start a generics drug company which would sell generic drugs at a cheaper price to American consumers. Mark Cuban had never heard of this Dr. Alexander Oshmiansky before, so the email was like a cold call to him, but it got the billionaire interested. Mark Cuban never liked the high drug prices, and he was already a prominent investor of several companies, so the two of them sat down and hatched a plan to disrupt the American drugs industry. Dr. Alexander Oshmiansky would provide the knowledge and work as the CEO of the company, while Mark Cuban would invest his money and take up an advisory role at the new company Cost Plus. For the next 3 years, both of them would go around getting all the registrations and certificates sorted out so they could start the company. Cuban Cost Plus Drug Company's business model is deceptively simple: offer low-cost versions of high-cost drugs. Cost Plus pricing model is extremely transparent. All drug prices are available on its website, while its pricing strategy is laid bare for all to see. The company will sell its drugs to consumers at a price which includes the wholesale cost plus a 15% markup, a $3 pharmacy labor charge, and $5 for shipping. Mark Cuban is also negotiating directly with drug manufacturers to get the lowest prices possible for Cost Plus customers. Right now, only a few generic drugs are available, but Cuban plans to widen its drug range to include drugs catering to an entire suite of conditions. Cost Plus does not accept health insurance, but users of the service will find drug prices on Cost Plus to be lower than those found in a brick-and-mortar pharmacy. For years now, the US prescription drug market has had problems with high prices for many of its medications. Cuban's new company wants to change that. Insurance companies are taking note of Mark Cuban's efforts. They stand to lose the most if Cuban's drug business model is proven to be successful. Insurance are always looking for ways to charge higher premiums, and Cuban's Cost cost-plus model undermines that. Most drugs in the US market are extremely expensive because of pharmacy benefit managers. People usually circumvent this through insurance providers which offer medicine coverage as long as their customers continue to pay their monthly insurance premiums. If a patient's main reason to pay monthly insurance premiums is to rely on insurance for medicines access, then Mark Cuban's lower drug prices would mean that people could skip their insurance and buy these cheaper drugs directly. According to the Cost Plus website, patients can buy leukemia drugs like imatinib at cheaper prices. They would not need to pay the price of $9,000 odd of monthly cost common in American retail pharmacies. Here are a few examples of cheap drugs available on Mark Cuban's drug company website. Vancomycin is an antibiotic which costs $32 on Cost Plus, while it costs $670 in American pharmacies. Memantine, an Alzheimer's drug on Cost Plus, costs $12.90 compared to its retail equivalent of $350. Prasugrel, a drug used to prevent strokes and heart attacks, costs $8.10 on Cost Plus, while you have to pay over $430 at the pharmacy to get it. Flucytosine, a drug used to treat fungal infection, can be bought for $265 on Mark Cuban's website, saving consumers over $900. Cyclobenzaprine, a drug used to treat muscle spasm, costs $53 on a website and saves customers $1,000. Sinacalet, a generic for Sensipar, is a drug used for treating thyroid problems in chronic kidney disease, costs $21 and saves patients over $1,600. Consumers can also save $1,000 on generic drugs like Epsicom used in the treatment of HIV. In general, cost-plus medicines are cheaper than those sold elsewhere. Forbes magazine estimates that the prescription drugs sold by Cost Plus were 10 times less compared to conventional drug prices. In general, generic drugs are not the biggest cost problems for customers. It is the brand name drugs that people have trouble getting because they are so expensive. Mark Cuban's model of going after people with no insurance is limiting because these people account for a small part of the market. There is also the problem with manufacturers. Mark Cuban has said that there are manufacturers afraid of working with Cost Plus because they are afraid of those big pharmacy benefit managers who do business with them and what they might do. Mark Cuban is trying to circumvent this by launching a pharmacy benefit manager of his own, but this time his PBM won't ask for rebates or distort drug prices. However, Mark Cuban still can't start a full-service benefit manager because to be a PBM you have to carry enough drugs, and right now Cuban's drug company does not have enough drugs yet to become one. A study conducted by the journal Annals of Internal Medicine estimated that Medicare would have saved almost $4 billion in 2020 by buying generic drugs from Mark Cuban's drug company. People who've seen the study, like Dr. Hussein, who works at the Boston Brigham and Women's Hospital, have confirmed that the actual savings that Mark Cuban's company could have saved the American government were likely much higher. This is a very positive development since Medicare costs US taxpayers over $115 billion to buy prescription drugs in 2021, accounting for a third of total US drug expenses. Medicare has been overpaying for some generic drugs for a long time now, so Mark Cuban is exploiting the gaps in the market through his company's affordable pricing schemes. Currently, Cost Plus only has over 700 generic drugs for a range of conditions from diabetes to allergies and cholesterol, but Mark Cuban has expressed his plans to expand the Cost Plus formulary to a dizzying 2,000 drugs by the end of the year, along with additions of brand name drugs. Mark Cuban is also committed to adding cheap insulin and adrenaline pen injectors like EpiPen to the service, two highly sought after life-saving drugs, but the billionaire refused to give a deadline, stating it might take 2 years or more. Cost Plus is currently allowing customers to put in requests for medications currently unavailable on the website. On the other side, brand name drug manufacturers see Cuban's Cost Plus company as a way to regain control of drug pricing. Four of the largest PBMs, CVS Caremakr, Express Scripts, Optum Rx, and Humana Pharmacy Solutions, have vertical integrations like pharmacy benefit managers, insurance companies, and a huge retail pharmacy presence, which allows them to distort pricing. Mark Cuban's drug company is able to work around them by not working through them, so the company can consider adding suppliers of various drugs into their network. America's prescription drug market is worth over $360 billion and has been due for disruption for some time now. To date, over 400,000 people have signed up on Cuban's Cost Plus online pharmacy website, while half of its users have purchased prescription drugs already. Things are ramping up, and Cuban has already started building a drug manufacturing plant in Dallas, Texas. Plenty of attempts have been made to start a generics drug company like Cuban's Cost Plus, which sells cheap drugs to American consumers. The reason these companies don't exist now is because the insurance companies, pharmacy benefit management companies, and other people involved in the current system will usually buy them out and kill them off. For Cuban, this venture is an opportunity to change millions of lives. Mark Cuban is a billionaire, the next dollar he makes won't change his life. The billionaire has expressed his disinterest in the buyout, so patients can rest assured that Cost Plus won't be going anywhere anytime soon. Like and subscribe.